So we just decided to start right on time, as we do in Germany normally. Welcome from this sauna in the European Parliament to all joining us here and from remote to this event, high-level event it is, on antimicrobial resistance. And I'll only pronounce that once and go to AMR afterwards, because that's, of course, easier. An event organized in partnership with the Quadripartite, the FAO, UNEP, WHO, WOAH, that is. I'll be short, just some procedural remarks in the beginning. We do have translation in English, German, and French. The event will be live streamed and recorded. Every participant will get a recording of the event. If you're not registered, you can still approach the team of Martin Häusling, and they'll be able to provide one. For all joining us remotely, the chat function is activated, so you can and may comment and ask questions via this channel. And that's all from my side. I am Hendrik Kafsak, journalist correspondent for the Frankfurter Allgemeine Zeitung here in Brussels. That's all from my side, and I'll hand over to Martin Häusling now for.
So, a very warm welcome from my side. I want to make my speech in German, so if you need translation, you must go to the German panel. It's channel 1. Ja, ich freue mich sehr, Sie zu dieser Veranstaltung herzlich begrüßen zu dürfen in der Sauna des Europäischen Parlaments. Wir hoffen, dass es noch ein bisschen bessere Aircondition gibt, aber im Moment ist es halt schwierig. Ja, diese Veranstaltung, die hat eine Vorgeschichte, um es ja deutsch zu sagen. Ich bin ja seit Jahren im Europäischen Parlament, seit 16 Jahren, um es genau zu sagen, und im Umweltausschuss und im Agrarausschuss. Und es gab noch zu der Zeit, bis vor der letzten Legislatur, noch keinen eigenen Gesundheitsausschuss, den wir jetzt haben. Und bei diesem damaligen Treffen mit Dr. Jean-Pierre Neumazy von der WHO, der im Umweltausschuss geredet hat, gab es dann die Idee zu sagen, wir müssen das Thema AMR eigentlich höher priorisieren, weil es wirklich ein Thema ist, was ganz oben auf der politischen Agenda stehen müsste, was wirklich für uns alle ein sehr entscheidendes Thema ist, und es hat mehr Aufmerksamkeit verdient. Meiner Meinung nach im Moment nicht genügend Aufmerksamkeit, aber wir wollen mit dieser Veranstaltung was dagegen tun. Ja, ich bin ganz stolz darauf, dass es uns gelungen ist, das Quadripartite, WHO, FAO, WOAH und UNEP zusammenzubringen hier, die in Zukunft ja global abgestimmte Maßnahmen gegen antimikrobielle Resistenzen organisieren sollen. Und nochmal vielen herzlichen Dank für Ihr Kommen. 2 Kollegen sind zugeschaltet. Und es war mir auch ein Anliegen, dass wir diese Veranstaltung fraktionsübergreifend ausrichten. Auch beim Thema Reduktion von Antibiotikaresistenzen brauchen wir die überparteiliche Zusammenarbeit über Grenzen hinweg. Mein Kollege Ușilescu kommt etwas später, der sitzt noch im Ausschuss, im Sonderausschuss, unserem neuen Ausschuss für Gesundheitsfragen. Frau Pietikäinen muss sich entschuldigen, die kann leider nicht. Und Frau Jeriewski von der S&D-Fraktion ist leider auch behindert. Wie gesagt, ein paar Worte zu mir. Ich bin seit 16 Jahren im Europäischen Parlament. Ich bin eigentlich gelernter Landwirt, bin da aber auch sehr intensiv mit dem Thema Antibiotika, habe ich mich längere Zeit auseinandergesetzt, auch hier politisch, weil ich war auch mit Schattenberichterstatter bei der Neugestaltung des europäischen Tierarzneimittelrechts. Und da haben wir einen Grundsatz festgeschrieben, der, glaube ich, immer noch viel zu wenig Beachtung findet. Wir dürfen mit Antibiotika nicht haltungsbedingte Schwierigkeiten ausgleichen, sondern wir müssen die Haltungsbedingungen verbessern. Das ist, glaube ich, ein Kernsatz, der wir eigentlich mehr Präsenz sozusagen in der Tierhaltung bringen wollten. Ich habe selbst dann im Europäischen Parlament einen Antrag eingebracht, dass wir im Bereich der Tierhaltung und nicht der Tierhalter, es geht nicht um Pfiffi oder um eine Katze, sondern es geht um die Tiermast, nämlich um Hühner und Schweine, dass wir da Reserveantibiotika nicht mehr einsetzen. Also die 5 Reserveantibiotika, die WHO selber auf die Liste gesetzt hat, als die Reserveantibiotika, die wir eigentlich, wenn es im humanen Bereich keine Antibiotika mehr wirken, dass wir die erhalten für die Humanmedizin. Leider ist das gescheitert. Gerade in Deutschland wird im Bereich der Hühnerhaltung, der Hühnermast noch eine Menge Cholestin eingesetzt, was ich ganz kritisch sehe, um es sehr deutlich zu sagen. Und darüber sollten wir auch reden, ob das wirklich in Zukunft so weitergeht. Um die Dramatik der Situation noch mal klar zu machen, jetzt schon sterben 1,3 Millionen Menschen an Antibiotikaresistenzen. Prognostiziert wird, dass wir in den nächsten Jahren fast 10 Millionen Menschen sterben werden an AMR. Mehr Menschen als an Krebs. Und ich glaube, die Dramatik, die wir da sehen, muss auf die politische Agenda, die muss ganz oben anstehen. Ich selber, wie gesagt, habe mich mit dem Thema der Tierhaltung beschäftigt. Ich selber bin Ökobauer zu Hause in Deutschland. Und ich denke, da ist es halt wichtig, dass wir da gute Beispiele setzen. Wie geht es denn mit weniger oder nur mit gezielten Einsatz von Antibiotika in der Tierhaltung? Wir haben die Situation, weltweit werden 70% der Antibiotikamengen in der Tierhaltung eingesetzt. Teilweise in Ländern außerhalb der Europäischen Union wirklich noch als Prophylaxe. Etwas, was wir in Europa nicht mehr haben. Aber deshalb ist in Europa nicht alles in Ordnung. In Europa werden auch 50% der Antibiotika in der Tiermast eingesetzt. Meiner Meinung nach immer noch viel zu viel. Eigentlich hatten wir bei der Farm-to-Fork-Strategie gesagt, wir wollten das bis zum Jahr 2030 auf die Hälfte reduzieren. Ich weiß nicht, ob wir dieses Ziel erreichen. Im Moment sieht es schwierig aus. Wir unterstützen natürlich auch im Europäischen Parlament fraktionsübergreifend den One Health-Ansatz. Und ich glaube, dass hier alle da sind, zeigt ja sehr deutlich, dass wir das auch so in Zukunft gestalten müssen, dass wir nicht die Sektoren jetzt wieder trennen, sondern dass wir ganz klar Humanmedizin, Tiermedizin, dass wir das zusammendenken müssen. Hier hat das Europäische Parlament insbesondere der ENVI-Ausschuss, also der Umweltausschuss und jetzt hoffentlich der Sonderausschuss Akzente gesetzt. Und ich hoffe, dass wir die Ziele, die die Europäische Farm-to-Fork-Strategie ja mal gesetzt hat, dass wir die erreichen können. Es ist nicht nur eine Frage natürlich ganz klar der Tiermedizin, sondern auch in der Humanmedizin wird immer noch zu sorglos Antibiotika eingesetzt, obwohl es andere Methoden gibt. Und ich denke, auch darüber müssen wir reden. Insgesamt das Ziel, weniger Antibiotika einzusetzen, vor allem die Antibiotika nicht mehr einzusetzen, die eigentlich unserer Meinung nach überflüssig sind, muss ein Ziel der Europäischen Union sein. Auch global müssen die Europäische Union das Thema setzen. Ein Punkt noch, weil ja oft diskutiert wird, und das haben wir auch im letzten ENVI-Ausschuss diskutiert, die Hoffnung, dass wir neue Antibiotika entwickeln und die Situation dadurch gelöst wird. Ich glaube, man kann im Moment sagen, die Hoffnung sollten wir nicht so hoch hängen. Leider haben wir seit langer Zeit keine neuen Antibiotikas auf den Markt bringen können und gebracht. Ich glaube, das ist nicht die Lösung, sondern die Antibiotika, die wir im Moment haben, die müssen wir sorgfältiger einsetzen. Ich hoffe, wir können mit dieser Diskussion heute einen Beitrag dazu bringen, das zum einen wieder politisch ganz vorne auf die Agenda zu setzen, zum anderen auch Austausch mit vielen Fachleuten hier dazu beizutragen, eine gute Diskussion hinzubekommen und das auch in die anderen Fraktionen im Europäischen Parlament zu bringen, dass wir es wirklich sachlich und wirklich im Interesse zukünftiger Generationen hier auch diskutieren und auch am Ende zum Ergebnis kommen, dass wir gemeinsam Ziele erarbeiten, wie wir AMR reduzieren können. Vielen Dank.
Vielen Dank, Herr Häusling. I now hand over to Yukiko Nakatani, Assistant Director General for Health Systems at the WHO, for her introduction.
Thank you very much for the good morning, everybody. Honorable members of the European Parliament and dear colleagues, dear friends. It is my great honor to be here today on behalf of the Quadripartite organization to provide the opening remark. As an escalating global threat associated with the 5 million deaths annually, AMR, the undermining the foundations of the modern medicine, animal health, food security, and environmental health, posing the serious challenge to sustainable development. Moreover, the AMR will cost the world $855 billion every year in terms of the additional health cost and lost productivity, and up to 11% decline in livestock productivity by 2050. So in 2015, the World Health Assembly adopted the first global action plan on AMR. This marks the pivotal step in our global response, which emphasized the need for the One Health approach by collective effort across the human health, animal health, agriculture, and environmental sectors, as well as the development of the multi-sectorial National Action Plan on AMR, which 178 countries had in place as of the last year. The momentum to tackle AMR led to a series of high-level opportunities commitments, including the setting up of the Quadripartite Joint Secretariat on AMR, and the establishment of the multi-partner trust funds. Global Leaders Group on AMR catalyzed the political actions, and launching the AMR multi-stakeholder partnership platform. Then finally, last year, member states adopted a political declaration at the UN General Assembly high-level meeting, in which world leaders agreed to key commitments and targets by 2030, some of which include reducing the human deaths associated with the bacterial AMR by 10%, establishing sustainable source of the financing to address AMR, establishing the independent panel for evidence on action against AMR, updating the global action plan, ensuring equitable access to effective and newly developed antimicrobials, diagnostics, vaccines for human and animal health, especially for low and middle income countries. Collectively, these initiatives have mobilized the positive global actions across the government, civil society, academia, and private sector. Honorable parliamentarians, distinguished guests, European support has been the central to advancing the global action on AMR. The EU and its member states have long championed a One Health approach, as well as provided the policy leadership, technical expertise, research support, helping shape the global AMR agenda by supporting the World Health Assembly resolution on AMR for the human health sector, committing €2.5 million to establishing the independent panel, providing the financial contributions to quadripartite organizations for hosting AMR multi-stakeholder partnership platform, optimizing research and development of the new antimicrobials, and supporting AMR multi-partner trust funds, so-called MPTF. MPTF is particularly an important mechanism to supporting the low and middle income countries to implement their own national action plan on AMR. This is also important financing cross-sector AMR initiative. It supports the countries that applying the One Health approach in their own country to implement all the actions, including the laboratory and regulatory capacities, and foster cross-sectoral regional collaboration. The EU has been the forefront of this mechanism, I seize this opportunity on behalf of the quadripartite organizations and would like to express our sincere gratitude for the generous support. Ladies and gentlemen, while tremendous progress has been made, I would like to highlight again the threat of AMR continues to escalate. Without sustained momentum and actions, we risk reversing the hand-won gains and making surgeries safer, improving the child survival, reducing the mortality due to the infectious disease globally. In this regard, honorable parliamentarians such as yourselves also have the vital role to play the helping the address AMR and for both the EU and globally. This is precisely why we are here today, to encourage honorable members of the EU Parliament to be champions for AMR and One Health approach, as well as leverage the launching the quadripartite policy brief on AMR for parliamentarians, which we will look more depth in the next panel. As a global health leader, Europe must remain the strong voice to ensure the AMR actions in globally, and it remains the AMR as the high-level political agenda. In conclusion, on behalf of the WHO and the Quadripartite Organization, I thank all European parliamentarians and officials for your support and addressing AMR. Particularly Honorable MdEP the Häusling, MdEP the Pitikanen, Jakobit, and Boikolesko for the organizing this important event today and inviting me and the quadripartite. Thank you very much. So I very much look forward to the subsequent discussions today. Thank you very much. Over to you.
Thank you, Yukiko. Before we start the debate, we'll switch to Philip Matthew, also WHO Technical Officer for AMR Awareness Campaign and Advocacy Unit, the unit that is, who will present the key actions to curb antimicrobial resistance. Policy brief for parliamentarians. You have the word.
Thank you so much, Honorable MEPs, ADG, UK colleagues and friends. It's a privilege to introduce the policy brief on parliamentary actions which are possible, published by the quadripartite in front of such an august audience. So I'll be rather brief. I'll try to limit it to less than 5 minutes and just go through the slides as quickly as possible. We did a consultation in 2022, inviting more than 200 different stakeholders, looking at what are the priority audiences for awareness raising and policy advocacy. And we found that parliamentarians are right on the top, primarily because of their huge influence in prioritizing policy agenda and also the resource mobilization part, their oversight over budgetary spending in a country or, in a multi-country, multilateral environment. So, along with these other audiences, we have decided and we've kind of had a very big outreach to different parliamentary networks to make sure that parliamentarians are firmly engaged in the global AMR agenda. Coming on to the role which the parliamentarians can play, we did a very brief literature review to find out any publications in this sector. Very few exist because there hasn't been much systematic approach towards engaging parliamentarians on various global health issues. But there is a lot of possibility that we could actually see. Parliamentarians, through their debating functions, through their supervisory functions, through their legislative functions, and also budgetary functions, could play a very big role in actually mainstreaming the AMR agenda and also ensuring that there is resource support and this is prioritized when there are policy discussions happening at a global, national, or even a subnational setting. So we identified a lot of challenges in advancing the AMR agenda at the national level, which includes everything from financing to poorly incentivized research and development, insufficient investment in agri-food systems. There is an issue with multi-sectoral coordination because it's a very multi-sectoral issue which requires a One Health approach, and the functions are in various ministries. There is a general lack of awareness. We don't have sufficient data to take informed decisions, so how do we generate more data? So there are a lot of issues associated with antimicrobial resistance, issues which prevent it from being mainstreamed and prioritized in a national setting. And we found out that parliamentarians can play a very critical role in actually mainstreaming it, making sure that this is a firm part of the national priorities and also the resource mobilization part. So just to give you a very brief outline of how we developed this policy brief, as I mentioned, we did a very brief literature review, and we had the draft document ready, which was reviewed by the technical teams and the legal teams. It was also peer reviewed by 2 parliamentary networks. I could see one of the network is actually represented here, Unite, and the G20 and G7 Health and Development Partnership. So we made sure that all the inputs are incorporated, not just from the technical teams, but from the legal teams also within the quadripartite organizations, and came out with a very brief document, which many of you will have with you already, which has 6 different sections, starting from an introduction, going into what are the key global actions taken so far to prevent and mitigate antimicrobial resistance, and why should we prioritize AMR globally, nationally, and also subnationally, an element which is missing in much of the debate. What are the key challenges that we are facing to tackling AMR nationally? Moving on to how can parliamentarians contribute, and where can people access? Parliamentarians or the offices of the parliamentarians can access standardized information from on AMR from various sectors. And we identified 11 different domains. And just to give you a brief outline of them, right from strengthening legislation to accountable governance mechanisms, advocating for policy development. Again, financing of national action plans is a big challenge. Less than 20% of the national action plans have budgetary allocation for them. As we all know, AMR is also a quality of care issue. It's a systemic issue, very much linked to the quality of healthcare delivery on the ground. So how do we incorporate AMR into the quality aspect of healthcare delivery? How can parliamentarians engage communities or their key constituencies? And how do we promote AMR research and development, AMR education in schools and universities? The environmental dimensions of AMR, how do we actually make sure that the policy formulation process incorporates that dimension also? Again, the multi-sectoral coordination and collaboration, and the agri-food systems part of it. And all of that kind of summarized in 11 different domains for ease of access and use. And this is just an example to show you how one of those sections will look like. I'm not going to read out the details, but again, we are trying to summarize and make sure that it is given in a very simple, understandable language, considering all the language barriers that we have. And we are focused on the key policy actions, not on much of details, because this can be adapted and contextualized in various national and international settings. Thank you so much for this opportunity, and back to you, moderator. Thank you.
That was short and crisp. Thanks a lot for this presentation. Are there any questions to Mr. Matthews just before we start with the debate, just to make sure that everybody is happy at the moment? Okay, if that doesn't seem to be the case. So then we'll start the panel debate. I like to keep that as interactive as possible, meaning if you want to jump in with a question, a command, do so, don't hesitate. That's also possible online. I know it's a bit more difficult to be spontaneously jumping in, to jump spontaneously in when you're online connected, but I just want to urge you to do so in any case. We have two participants joining us from remote. That's also due to the general strike we have at the moment in Brussels, I assume. So let's hope for the best that we don't run into too many technical problems. I mean, we had Corona, I don't know how many years ago, and we still do run into technical problems when it comes to that, but we'll hope for the best. Let me just shortly introduce my panel. The two here, we've heard Yukiko Nakatani already. What do I need to tell you about her? Since 2024, responsible for AMR, if I'm not mistaken, worked as a director for cancer and disease control in the Japanese Ministry of Health, and also, that's why I mentioned Corona, in the fight against Corona in Japan. To her right-hand side, we have, where are you? Sorry, Veronica. I just wanted to pronounce your second name correctly. That's why I was hesitating. It's Veronica Hunt-Shafrankova. Is that correct? Okay, we'll stick to the first name basis. Representing UNEP here as head of Brussels office since 2019, with a long history in the Czech Ministry of Environment, also served as a deputy minister ages ago, if I may phrase it that way. And then from remote, I don't see any faces yet. I hope you're here. On the one side, Javier Yugueros Marcos for the WOAH. He is head of AMR and Veterinary Products Department, and before had a long history and experience in development and commercialization of diagnostic tests in human and animal health. And we also have Tanawat Dinsen from remote for the FAO. He's Assistant Director General for Animal Products and Health in the Health Division and Chief Veterinarian. Worked from 2018 to 2022 in the Ministry of Agriculture in Thailand, and also as Perm Rep for Thailand to the UN agencies in Rome. And I think I stick to that by way of introduction. I would like to start with a very broad question, because Mr. Häusling or Martin, we on a first name basis here, Martin mentioned before that he has the impression that the support or the awareness that AMR, to put it in other way, is not anymore high enough on the agenda of politicians, both within the European Union and outside. And I would like to hear from your side, maybe we start remote. Tanawat, if you want to jump in directly, do you share this assessment, or are you a little bit more optimistic when it comes to that?
Okay.
We can hear you. No, we cannot hear you anymore.
Can you hear me?
Now we can.
Okay, thank you very much. Thank you for inviting me to join these discussions. As the Member of Parliament, Mr. Häusling mentioned, and also he himself as a farmers and producers, we know that today 70% of antimicrobials, antibiotics is used in agriculture, livestock production, aquaculture, and even though today our farmers are well advanced to use antibiotics in plant productions. But now if we just focus on the part of the animal production or livestock productions, we know that in European Union, a part of your farm to fork strategies and also One Health AMR strategies and policies. And you already have a plan that by 2030, you would like to reduce the use of antimicrobials, antibiotics by 50%. And that's why I think this one is already give a signal, is a strong signal, a strong policy for farmers and producers. Now, in terms of misuse, overuse, over the past year, need to change, and need to change the way that you do farming here. But we know that in other countries, in other continents, in other regions, maybe it's different. And that's why if we would like to deal with the situation of the use of 70% in agriculture's livestock production, aquaculture and plant production. And that's why we need a strong policy. And you as a parliamentarian, here in EU or even though elsewhere, the parliamentarians You are the one who have a legal powers, you have a political powers, that you can drive all the legislations that can support our farmers to produce better, to make sure that have a good animal husbandry practices, to make sure that we have a good veterinary service at the country level, and also to make sure that we have a good system in place to support our farmers and producers. And that's why I myself, as a food and agriculture organization, now we are discussing about better production, better nutrition, better environment, and a better life. And that's why we need to make sure that we need to change the way that we produce our food. And that's why I'm still very positive with support of parliamentarians, with your power, and we can transform the way that we produce to make sure that at the end we have a safe food, healthy food, and nutritious food for our consumers. And that's why it linked to the antimicrobial resistance. If we have a resistance of bacteria contaminate in our food, will have an impact to our health. If our animal, cow, chicken, pigs, tomorrow they get sick, but they don't have any antibiotics that can treat them, they also will have a problem of food security, nutritional security. And that's why always when we're talking about antimicrobial resistance, this issue is not human health threat, but it linked to food security, animal production, animal health. And even though we know that all the waste from animal farms, it go to soil and water. And that's why in terms of the contamination of antimicrobial resistance will go to soil and water. We know that in our soil also have microorganisms. And that's why we'll have an impact directly to our health at the end. But always just to highlight that, as you mentioned, we need to be positive. We need to work together. And we need to make sure that we can utilize the tools and power that you have at the parliament to support the work of the government, to support the work of our farmers and producers, to make sure that at the end we can support the countries to invest in national action plan, how to deliver results, to reduce the use of antibiotics and antimicrobials. At the same time, how to scale up the surveillance and data system that I will talk later, how the FAO and other quadripartite organization can support the countries. And also at the end, we need to prevent, because of the cost of the prevention is cheaper than the cost of treatment. And that's why we need to control the issue at source. If we're talking about 70% of use in agriculture, animal production, aquaculture, and plant production, please pay more attention on that part, and then we can manage the situation better. And at the same time, among the quadripartite organization, even though when you go to the country level, I can give you an example, Ministry of Health and Ministry of Agriculture. When you're talking about the control of use of antibiotics and antimicrobials, the legislation is under the Ministry of Health. Maybe the Ministry of Agriculture have no legislation. And that's why sometimes sharing the legislation, sharing powers, how to delegate the powers from one ministry to another ministry to do the work. And that's why the One Health happened, because we have the same goal to keep our people, our animal, our agriculture, or even though our planet healthier. And that's why I'm sure that with your support as a parliamentarian, with your powers, I think we can do better and very positive. Thank you very much.
Thank you for that intervention. Javier, if I may just jump to you. Mr. Tanawat, you painted a very, very positive picture and you made a strong case. I just want to stick to the point Martin made before, because I mean, the European Union likes to paint itself as a front runner when it comes to fight against AMR and of course, other issues as well. Yet at the moment, we see that AMR and other environment or climate-related topics are not really that high on the agenda anymore. The farm-to-fork strategy that was mentioned before by Martin is something that's not even discussed anymore. The focus is more on competitiveness, other things. So I'm a little bit worried that in the end, although there's a strong case for action, AMR might be left behind.
Okay, thank you very much. First of all, thank you for the opportunity to be here and for organizing this. And if you want me to draw a less positive picture, I could do it. But I think the geopolitical context is very complex, as you know, and the budgets are flying away from health and multilateralism and international cooperation into other envelopes. So I think, I think we need to face the reality, and as you say, we have to see the facts and what is happening, and not the words. And as you see, the topic is less discussed at the international level, or is losing some attention. But I think we do not have the choice other than being optimistic and keep fighting. I would say not keep the fight against microorganisms, because we will never win that. They will always adapt and evolve faster than us. But I think we need to keep the fight in advocacy, in awareness, and in focusing our behavior in changing into a prevention. I think the key to reduce the use of antimicrobials is more focused on the preventative measures, which start by proper animal husbandry practices. And I think this is a strong message that I would like to deliver to the European parliamentarians. Whenever you're thinking about legislations, think about animal husbandry and sustainable production systems. I know that you mentioned the thing about competitiveness and maybe profitability. And I think on that side with FAO, we are fully aligned on the fact that we need to develop sustainable systems and not only looking at profitability, because in the end, they are not going to pay off. Then the second aspect of the prevention must be the biosecurity, infection prevention and control, called in humans, but also biosecurity in farming. And I encourage parliamentarians to have a look to the report that was published in 2022 by the World Bank on how to put pandemics behind us. That's the name. And in this report, they were saying that the interventions to prevent the spread of the development and the spread of new pandemics was much cost-effective than the investments in preparedness. And if you look at the 11 billion globally annually that should be invested in prevention, those two of the main pillars of that investments were in strengthening veterinary services as well as strengthening biosecurity on farms. And I think that will not only apply to the new pandemics, but also to the development and spread of AMR. So that's the second pillar that I would like to emphasize in terms of optimism. And then the third one is vaccination. Vaccination is today a tool which is completely underutilized. And WOAH, you do not need to go on to WOAH. I think it's complicated. We call ourselves WOAH. We are an international standards organization. And that means that we, together with the 183 members, we adopt international standards on how to use responsibly antimicrobials in animal health. And one of the things that we have, it's a priority list of diseases where vaccination can replace and can reduce the use of antimicrobials. And these lists are not well known, as well as not at all implemented in many countries. And that's the main focus that we are going to put our efforts on in the years to come. And that's also one of the commitments from the political declaration last year signed by the United Nations member states, where you have 4 commitments for animal health, one of them being ensuring that countries have vaccination strategies to reduce antimicrobial use, which mechanically will lead us to the commitment to the achievement of the other commitments, which are reduction of the use as well as responsible use with the complete phase out of antimicrobials as growth promoters. And then the 4th commitment from the political declaration is investment. I know that this is not a very popular topic nowadays, and I do not want just to come to you saying we need money, but you want me to be honest, we need money. We need money for this, for strengthening animal health systems, as well as for strengthening health systems overall. as well as the waste and management of antimicrobials and pollutants, but that my colleagues from UNEP will probably talk more about that. And on that side, I would say that the European Union, I mean, no one is perfect, but honestly, the European Union, you have been a leading example on how to fight and how to contain the development and the spread of antimicrobial resistance with legislation, transparency, and also investments within your territory as well as outside of the territory with fantastic programs that have helped other countries to come up to speed and to increase their level of surveillance in this topic. So I do not want to go further than that. I think I picture the realistic photo of the world, which in the end, in one nutshell, is even though the context is difficult, we must remain optimistic and we must deal with this problem, because otherwise we will not be sustainably living in this planet anymore. Over to you.
Thank you. So we came from realism to optimism again. And I know as a journalist, we tend to be always too negative. Veronica? I just wondering, is this for the very last time? No, I'd just like to hear from your point of view, because I mean, you're based in Brussels, how you really see the European Union in the fight against AMR, particularly with view to von der Leyen I, the last commissioner of Ursula von der Leyen, and the new one, or the running one, because we've seen some shift in tone and content.
Yes, indeed, and thank you very much. And first of all, thank you very much, Martin, for hosting us and for your efforts to for this important topic to remain on the political agenda, which is indeed not easy, especially in these days. And I very much concur what colleagues mentioned before. But indeed, the last mandate, we had the very clear political priority, the European Green Deal, with farm to fork, with biodiversity strategy, zero pollution agenda, etc., etc. And it's it stays. The implementation needs to kick off, or it's kicking off. But the political discussions are much more complicated. That's true, and the competitiveness is the prevailing focus at the moment. So the plea would be to really keep the focus on the elements of the Green Deal, which was always intended as the transformative agenda, bringing the sectors together. So this is a reminder that it's very much needed, and AMR is an excellent example of that. And as it was mentioned, the work of the Quadripartite, but also Javier and Yukiko mentioned the political declaration adopted last year at the UN General Assembly, very much highlighting the cross-sectoral cooperation and the need to have environment, agriculture, and other sectors working together. So we do see shift definitely in the narrative now. I think it's what we collectively, I think lots of different partners here try to explain, that it doesn't go against each other. The green policies don't go against the competitiveness. On contrary, it should be seen as very much interconnected, and we cannot have competitiveness if we don't have health and environment in order. I think we heard also a number on the also economical impacts. But what was started during the first political mandate, the strategies, they are very much embedded now with the legislation, also the revision of the Urban Wastewater Treatment Directive. But we need to safeguard this space, and the discussion also in the European Parliament. We need to be communicating the economics, the health sides of it, social impacts, but also the real stories. And what we have received here today, the message is that on AMR, that it's not anything abstract. These are real cases, real people that die, and the numbers are very striking, what Yukiko mentioned. So in the discussion, the political discussion in the EU at the moment, in the context of competitiveness and resilience, we need to keep reminding decision makers, policy makers, that it is real. And we cannot maintain the economic and social side if we neglect this.
Thank you. Now it's working. Martin, may I just shortly bring you in? How do you convince the farmers to join into this campaign? Because, I mean, that was one of the reasons why we've seen such a backlash, because in certain member states, there was quite some opposition, not only against the fight against MR, we were talking also about pesticides, but we've seen the protests last year, beginning of last year. How do you want to do that?
Ja, I make my speech in German again. So, ja, es ist ja schon gesagt worden, wir haben eine schwierige politische Situation. Alles, was, wenn jetzt ein Entwurf kommt, dann heißt es sofort Bureaucratic Burden und gerade bei den Bauern sehr unbeliebt, dass man irgendwelche Auflagen macht, dass man Kontrolle in den Vordergrund stellt. Das wird alles als Belastung gesehen. Und das andere Argument ist ja, außerhalb der Europäischen Union wird ja noch viel mehr Antibiotika eingesetzt. Also warum sollen wir das jetzt machen? Und das ist eine Wettbewerbsverzerrung, das wird ja gesagt. Ich habe ja schon am Anfang gesagt, mein Kampf hat sich ja mal bezogen auf bei der Veränderung der Gesetzgebung im Bereich der Tierhaltung. Bei dem Arzneimittelanwendung ging es ja darum zu sagen, wir dürfen schlechte Haltungsbedingungen nicht ausgleichen mit Antibiotika. Um konkret ein Beispiel zu nennen, wir haben heute Hühnerställe, da sind mindestens 30.000 Hühner in einem Stall. Wenn da 3 Hühner anfangen zu husten, bekommen die anderen Tausenden von Tieren auch Antibiotika über die Tränken, das Trinkwasser. Und das ist eine Praxis, die wir eigentlich einschränken müssten. In der Hühnerhaltung ein bisschen schwieriger, aber in der Schweinehaltung könnte man zum Beispiel separieren. Das wird nicht gemacht, weil es verursacht Kosten. Also wenden wir die Masse der Antibiotika eigentlich in der Tierhaltung an völlig gesunden Tieren. Und da brauchen wir uns nicht zu wundern, wenn immer mehr antibiotikaresistente Keime entstehen. Ich glaube, das ist das Kernproblem. Dann ist ja schon gesagt worden, wir hatten die Farm-to-Fork-Strategie. Wir hatten, sage ich ja, weil der jetzige Agrarkommissar redet da gar nicht mehr von. Er sagt, das wäre überholt. Ich finde, nach wie vor steht das immer noch im Raum. Und 50% Senkung von Antibiotikaeinsatz in der Landwirtschaft hat in den ersten Jahren auch gut funktioniert. Ich glaube allein deshalb, weil wir sehr intensiv darüber diskutiert haben, dass die Bauern merken, wir müssen da was ändern. Aber jetzt sind wir an einem Punkt gekommen, zum Beispiel in der Hühnermast gibt es keine Reduktion mehr, weil wir da die Haltungsbedingungen nicht ändern. Und das ist halt ein riesiges Problem, vor dem wir stehen. Also ich sage mal ganz provokativ, wir machen keine Prophylaxe mehr im Antibiotikaeinsatz, aber wir haben die Metaphylaxe. Und das müssen wir wesentlich mehr einschränken. Also wir müssen über Tierhaltungsformen reden, wir müssen über die Massentierhaltung reden und letztendlich müssen wir auch darüber reden, über das System, und es ist ja gesagt worden, in dem wir gerade stehen, im internationalen Wettbewerb, Masse produzieren, billig produzieren, ist im Moment angesagt. Ich glaube, ich soll ja optimistisch sein. Ich glaube, wir müssen das Thema tatsächlich auch damit verbinden, dass gute Haltungsbedingungen für die Bauern auch bedeuten, die Tiere sind gesünder. Das, glaube ich, muss man den Bauern klar machen. Und dass die Landwirtschaft davon profitiert, letztendlich, wenn sie Haltungsbedingungen bei den Tieren ändert, wenn sie auf weniger Antibiotika einsetzen muss. Und es ist ja auch, muss ich auch sagen, ein Problem für die Bauern selbst, für die Bauern und für die Tierärzte. Es gibt keine Gruppe, die mehr belastet ist als Landwirte, die damit dauernden Umgang haben. Das müssen die Landwirte, glaube ich, auch verstehen, dass das für sie selber auch ein Problem ist. Insofern denke ich, wenn wir das wieder auf die Agenda bringen und auch ja, die 50% Reduktion weiterhin als Ziel behalten, dann können wir vorwärts gehen. Letztens hat der Verbraucherschutzkommissar vorgestellt, wie es denn vorwärts geht und hat gesagt, ja, es geht weiter vorwärts. Ja, aber es gibt leider im letzten Jahr keinen großen Fortschritt in der Senkung, sondern wir stehen da quasi auf demselben Niveau. Und ich glaube auch, das muss dann wirklich auch politisch geklärt werden. Und letzter Satz, was ich immer denke im Moment, ist, steht so die Hoffnung, ja, wir erfinden was Neues. Wir erfinden eine neue Antibiotika und dann können wir ja weiterhin Antibiotika einsetzen. Ich glaube, das habe ich vorhin auch deutlich gemacht, ich glaube, diese Hoffnung, wir erfinden jetzt neue Antibiotika und werden das Problem lösen, ist eine falsche Hoffnung.
There's one raised hand. Would you just already say who you are and?
Yeah, my name is Faisal Wardak. I have a pharmaceutical background and I'm a member of the UNITE network. And thank you very much, Mr. Kafsak, for that very good question. Since we all experienced the protests and Mr. Häusling, you rightly pointed out what is going wrong. But do you have any practical steps that can be taken to face that challenge? Since you have also a farming background. Ich kann das nochmal auf Deutsch, ich kann nochmal die Frage auf Deutsch stellen, wenn das, also ich hatte nämlich nach den konkreten, also haben Sie selber, weil Sie ja einen praktischen Hintergrund haben, haben Sie vielleicht konkrete Maßnahmen, die praktisch sind und Bauern nicht unter Druck setzen?
Ja, Bauern nicht unter Druck setzen. Ich glaube, wir müssen die Landwirtschaft ein bisschen unter Druck setzen, weil das Bewusstsein muss erstmal klar sein. Bis jetzt ist es ja sehr einfach. Es ist auch billig, muss ich auch sagen. Es ist billiger, Antibiotika einzusetzen, als ein Haltungssystem zu ändern. Wir sehen aber auch, im ökologischen Landbau ist der prophylaktische Einsatz und der metaphylaktische Einsatz von Antibiotika verboten. Und es geht. Warum? Weil man also andere Haltungsbedingungen hat, weil man robuste Rassen hat. Das kommt ja auch dazu. Ich meine, wir haben heute Tierrassen, die eingesetzt werden, die sehr anfällig sind, weil sie auf Wachstum getrimmt sind. Das könnte man ändern. Und ich denke, um ein anderes Beispiel zu nennen, wenn man wirklich, dann nenne ich jetzt mal Dänemark als positives Beispiel. Dänemark hat zum Beispiel es geschafft, den Einsatz von Reserveantibiotika in der Hühnerhaltung komplett abzustellen. Ich glaube, das ist im Gegensatz zu Deutschland gelungen, zum Beispiel Cholestin aus der Tierhaltung rauszunehmen. Von diesen positiven Beispielen müssen wir halt lernen. Und das andere ist ja schon angesprochen worden, ob wir mit Impfungsstrategien tatsächlich auch was erreichen können. Ich glaube, das ist eine gute Maßnahme, wenn wir uns mehr auf Impfung konzentrieren in der Vorbeuge. Ich glaube, da ist noch einiges an Möglichkeiten da und das müssen wir stärker ausbauen.
Javi, if I just may bring you in for a moment. Tanawat, you can, I saw you nodding several times, but I would just like to ask Javi first, because the prevention was mentioned, and you mentioned it before as well, the vaccination at least. What can the European Union do on the one side to promote this approach, and what are you actually doing, the WOAH, as you pronounce it, worldwide, to convince farmers that they go down that road instead of the easy path by just using antibiotics?
Yeah, thank you for the question and for bringing the vaccination onto the table. What we are doing, in very simple words, is we are updating the priority list of diseases for which vaccination can reduce the use of antimicrobials. And within this exercise that will be completed in the next 12 months from the scientific perspective, we will also include a component of achievability of the implementation of this list in the field by identifying the top 5 priority of the priority diseases on which something can be done worldwide, or at least at a regional level, from now to 2030. So these are the two main actions that we are carrying out at this moment from our perspective. Then, what can you do at the European level? I would say is to invest more. I'm coming to the funding, but I'm coming to the funding because if you look at the numbers from the Global AMR Hub, which is an organization that was originally born in Germany when Germany was handling the G20 presidency. They are managing a dashboard of the investments on R&D for AMR. And when you look at the number of the rate of investments in AMR for animal health overall, it's only 7%. 7% of the total amount of money coming from the public side and the philanthropic organizations is invested in animal health. And from that percentage, only 7 cents out of $10, 7 cents out of $10, or 10 euros if you want, because the rate is the same, are invested in vaccines for animals. So this is the funding that is coming from the public and philanthropic entities. So one way to counterpart that and to invest more, optimizing the investment, is by building a strong public-private partnerships. And I think on that side, the European Union and the European Parliament can set the right place, is the right place to set the right rules to build these private-public partnerships so that the private sector is also involved into that. And when I say private sector, we do not only mention the pharmaceutical industry, but also the big organizations producing the animals. They have to implement this thing. Those were some of the things that were discussed at the last General Assembly from the organization, where we had a forum dedicated to vaccines with an internationally adopted resolution coming onto that sense. I can send you the information after the meeting so that you can have a look at that. But in a nutshell, is building the case for stronger investments in animal health by emphasizing the importance and leveraging the public-private partnerships. Over to you.
Talawat, you wanted to react to what Martin said. We cannot hear you. You need to press.
Okay, yeah. Okay, thank you very much. I think Martin and I, we share our experience because I myself grew up in chicken farms in Thailand. And we know that over the past 20 years, 30 years, we're talking about how to produce more. Because if you look at today as well, today we are producing to feed 8 billion people around the world. But by 2050, we are in the pressure to produce enough for 10 billion people. And that's why we know that if we continue this, by 2050, the demand of animal source food, whatever meat, milk, egg, will increase around 20 to 30% to meet the demand of that by 2050. And we know that the way that we produce over the past 3 decades, when you want to produce more, you need to increase the density of animal in farm. And when you increase the number of animals in farms, you also have a problem of good practices, hygiene, animal husbandries, farming system that introduce more disease, pathogens, virus, bacteria, and so on. And that's why over the past 30 years, many countries use antibiotic as growth promoter for prophylaxis to prevent. But we know that everything is a cost, because when you're talking about competitiveness, we know that today, when I was the permanent representative to UN agencies in Rome, and also as the chairperson of the Committee of World Food Security, CFS, and I met many farmers. And we know that today our farmers, and even though in our European Union, they are complaining. I visited many farmers, they're crying. They say that why you came to me, you want to bring me more headache, more regulation, more legislation, because today I'm already very difficult to produce food to feed you. But the more legislation, it makes my business even though worse. And that's why we need to balance how to keep competitiveness, but at the same time produce safe food, nutritious food, and healthy food. And that's why it's a joint responsibility between farmers, producers, and also with the government. Because producing food have a high responsibility, because you need to deliver something very safe, healthy, and nutritious. And that's why last year, just before the UN General Assembly political meeting that we have the AMR declaration. At FAO, we launched the initiative called the Global 10-Year Initiative called RenoFarm, reduce the need of antimicrobials on farm for sustainable agri-food system. And we introduced the very simple concept we call 5G, good production practices, good health services, good alternative, good incentive, and good connection. What does it mean by 5G? As I told you, if we have a good production practices or good animal husbandry, good farming practices, ensure that animals or farmers, they don't need to use antibiotics or antimicrobials because animal is healthy. If you keep everything function well, you have a clean waters, you have a good bedding system at the farm, whatever, chicken farm, dairy farms, or pig farms. If ventilation in the farm, even though you have organic farming system or outdoor, semi-outdoor, semi-intensive, because the different system have a pro and con. And that's why if you really have a good farming practices, you reduce the use of antibiotics quickly, and even though you don't need it. And if you have a good animal health service to make sure that between veterinarian, farmers, you have improved the health of animals at the farm, and also you don't need antibiotics. And that's why it comes to the good alternative. It's not only vaccine. We still have probiotics, have a better feeding system, improve the feeding management, and also the vaccine. Everything is it's costly. Even though one vaccine is already cost for our farmers, producers. And that's why if we really have this kind, even though some countries, they introduce the use of traditional herbs that can also improve the health of animals, and also introduce the probiotics and others. And this one is also improve the health of animal, improve the animal husbandry at the farm. And next, good incentive. Because that in different countries have a different capacity to support farmers. Maybe in EU you have more to support. But in other countries, I just came back from Africa. In Africa, the chicken farms and in Africa, farmers don't talk about antibiotics. They talk that they have to make sure that they have enough feed to give to their animal, to their chickens. Because they have a good farming system, they don't need antibiotics. And that's why at the end, we also need an incentive. And that's why in some countries in Europe, we know that you have the incentive system that can help farmers to reduce the use of antibiotics. So even though to improve the farming system, because in EU today it's not only about antibiotics, about emission, about nitrogen in soil and water. Your farmers is working under pressures. And that's why just last 2 weeks, I also witnessed the protest of farmers in some countries, and even though over the past 2 years. And the last one is a good connection, sharing good practices among farmers. As Martin mentioned, producers in Germany, in Denmark, in Sweden, how they can reduce, even though in Netherlands, how they can reduce from up to 20, 30, and even though some country almost 50 already. And that's why the RenoFarm initiative, even though now today in some other country in Asia and Latin America, they already adopted the concept of RenoFarm 5G, good health service, good alternative. Even though they're going to work with the private sector to have such a kind of scheme that we can work together to continue produce more, but with less health impact to people, health impact to our farmers and also to our animals, and at the end to make sure that we continue to feed healthy food, nutritious food, and safe food to our consumer, and also to all of you who are joining this discussion. Thank you.
Thank you, Yukiko. You've been waiting very patiently. I don't know whether you want to jump in here, because Veronica already raised her hand again. If you want it short, please. Just.
No, I do apologize. I just wanted to react on the question and also what Tanavat mentioned on the production, as I'll be super brief, because this is indeed also an important question. And according to the data that we have from last year, the food waste and loss is huge. So it's very much linked to sustainable consumption and production, or unsustainable consumption, so to say. There is about 1 billion meals per year wasted. So there is the question: do we have to have the pressure on agriculture as it is if we have such a high food waste and food loss? So that was just to very quickly react on that.
And I saw Javi reacting again, but I just make a cut here and jump to the topic Javi mentioned as well. How did you phrase it? I don't want to talk about money, but we need money. We've heard from before that only 11%, I think it was, of the NAPs are sufficiently funded. So there's clearly a lack of money. Yukiko, from your point of view, what can the European Union do to support that? We've seen that development aid is not necessarily, there's not necessarily more development aid at the moment. We've seen the United States cutting back their aid. What can we do to efficiently support other states in their fight against AMR?
Okay, so thank you very much. First of all, I deeply appreciate the European Union to supporting the AMR actions, including the financial part. For example, the UHC partnership, this is only for the human sector, but I'm now the representative of the WHO. So the UHC partnership, they invested more than 100 million euros for the many years to increasing the capacity in the countries. More than 140 advisors sitting together with the Ministry of Health to supporting the Ministry of Health to change the legislation in their country, and also leading the discussion across the government, including the Ministry of Finance, Ministry of Health, Ministry of the Education for the others. In case of the AMRs, also involving the Ministry of the Agriculture, Ministry of the Environment, all those the stakeholders sitting together on the table to discuss how we can mobilize more domestic finance to the specific activities which should be the priority in their country. So then what WHO doing, what WHO advisor doing at the country? So advisor providing the exact data using the indicator to monitor for the progress. For example, for the how many people saving the life, their children under the 5 years old. And this is also the monitoring indicator providing the every 2 years, and then they making the mapping of the activities and what is the target coming 5 years, for example. Then they discuss, they see the data, then also needs to discuss on the revision of the legislation to mobilize the additional funding source, such as the taxes. In case of the obesity, we are talking about the tax for sugar, for example, and also something the concessional loan to supporting the to fill out of the funding bankrupt of the health systems. So what I want to say, so the European Union is a strong leadership to leading this One Health approach in the world. But this activities should the quadripartite organization support to the capacity building in the country to be able to translate of the global action plan or the national action plan into the actual operation in the country. This is also important to the promoting the actual activities in the country to make a change. Then I think European Union leading all those activities through some of the framework within the health sector. So I think, for example, for the vaccination for animals, so the Ministry of Health and the Ministry of Agriculture have to work together. Maybe is the Ministry of Health can transfer the know-how of the regulation of the health product, regulation to ensure the quality of the health product, and also we can transfer the know-how for the immunization framework and the animal health. On this kind of the activities we can support, but the country have to engage and the country have to commit what they want to do, what they have to do to saving more lives, and then not only human life, but the more healthier life. So that's my comment. Let me stop here.
Okay, just a short follow-up. There still seems to be quite a lack of financing. Javier mentioned public-private partnerships as a possible answer to that. Where do we get all this money from? Is it really the private side we need to bring in? And if so, how do we do that? And when we say private side, what private side are we actually talking about?
To me?
Yeah.
Private sector. In terms of the collaboration with private sector, a few years ago, like after the first global action plan on AMR, we engaged with the Association of the Industry to create with the AMR Action Fund to provide the financial support to the manufacturer to develop and then new antibiotics. Because it takes a long time, so as Martin mentioned at the beginning. Then there are in total funds was the 1 billion. Then meantime, the WHO prioritized the products or the pathogens are what we need. Then we allocate those funds to the manufacturer to develop or the produce of the specific prioritized the product. Then meantime, so we also supporting the make sure the market after the production. So the manufacturer needs to produce the profit through that product. Otherwise, AMR Action Fund is not the forever. So this is just the initial financial support. Meantime, WHO coordinate with the countries, the regions to make sure the pooled procurement system to providing the significant size of the market.
Apparently we have a problem with the connection. So it's Javier, you can hear us well. So it's just you, Tanawat. Maybe you can just check or just reconnect, and then we'll see whether it works afterwards. So just go ahead.
Thank you so much. So let me summarize. So let me summarize what we want to say. Then, when we have to collaborate with private sector, we have to provide a comprehensive program for them. Then they encourage the private sector on board with us, which is not only the research and development. We have to provide the fast track for the regulatory system and also robust market shaping, including the pooled procurement system. And also, manufacturer asked us, so we producing our product for saving lives. But if we the commercialize this product, the certain countries doesn't have the proper use system. They're afraid to create a new resistance products, their own products. So meantime, we have to empower the health systems in the certain countries together. So in all those, we have to create of the strategy as the holistic way. Then we shows, then provides private sector can onboard. So that is the strategy I want to emphasize. Thank you.
Thank you, Yukiko. Javier, back to you, because you brought this up. Could you be a little bit more concrete about what you have in mind when you talk? Just give us a specific example how you want to bring in the private sector and create those public-private partnerships, PPPs.
Yeah, thank you very much. As I said before, it was a point of discussion during our last General Assembly in the Animal Health Forum, where we discussed vaccines and vaccination. And what we are trying to do is we are trying to explore a mechanism to foster this dialogue where both our members, which are represented by the governments, as well as the private sector, pharmaceutical industry, and as I said, the producers of animals, that can sit together and find the ways to collaborate together. We are initiating that path forward. We have different collaboration agreements with all these sectors: the poultry sector, the swine sector, the beef sector, internationally speaking. And we are going to focus a little bit these discussions on vaccines and vaccination. My colleague Tana Watt was mentioning that vaccines are expensive, and it's true. But they have been very successful. I have the example of the salmon industry that probably you all know in Norway, where we can see that the vaccination of this production is representing today 50% up to 15% of the global cost of production for salmon. But we need to find ways and mechanisms to reduce those costs and to implement that in other sectors where the cost-benefit analysis is still to be demonstrated. And then I would say that one powerful thing that we should explore, and on that side I think parliamentarians have a critical role to play, is where to put the incentives. When we talk about sustainable development and we talk about legislation, we can drive where the investments are going depending on where the incentives are being put. So by putting incentives to the right place where sustainable farming is rewarded, or the development of new vaccines for animals, or development of new ways of administering vaccines for animals, because in some cases we have the vaccine, the biology is there, but the way of administering the vaccine is not there. So having this kind of push incentives to the innovations, as well as then some sort of pull incentives, provided there is sustainable use of those vaccines in sustainable systems, I think we believe it's also a powerful tool to drive these discussions, as well as where the money from the private sector is going to be dedicated. Because as my colleague Yukiko was mentioning, the private sector needs to get a return on investment. And I'm not saying that the public sector has to pay for all the development, but I mean to guide them into to point them towards the right place for a sustainable development. And then I echo my other colleague from UNEP. Do we really need to intensify production systems when we have such a number of waste? I think this is a question that we have to put on the table, and that legislator has to put on the table to put the right incentives at the right place. Over to you.
Ich wollte noch was sagen, weil Initiativen der Europäischen Union war ja auch letztens, dass wir, kann man mich hören? War ja, dass wir versuchen, zum einen neue Antibiotika zu entwickeln und dafür auch Geld zur Verfügung stellen, weil wir wissen ja nicht genau, warum werden keine neuen Antibiotika entwickelt, weil die Möglichkeiten nicht da sind oder weil es sich nicht lohnt. Viele sagen, es lohnt sich für die Firmen nicht, neue Antibiotika zu entwickeln. Das Geschäft ist nicht lohnend genug. Das heißt, da hat ja die Europäische Union schon eine Maßnahme ergriffen, sagen wir fördern diejenigen, die neue Antibiotika entwickeln. Das andere ist, dass wir, glaube ich, auch über Lieferketten nachdenken müssen. Wir haben ja gesehen in der Corona-Pandemie, wie schnell Lieferketten zusammengebrochen sind. Und auch das ist ja auf der Agenda gewesen, jetzt im neuen Gesundheitsausschuss, dass wir dafür sorgen, dass wir zum einen Reserven anlegen, zum anderen auch versuchen, ein Stück weit wieder Produktion nach Europa zu holen, um nicht abhängig zu werden. Und wir wissen, dass gerade die Antibiotikaproduktion in Ländern wie Indien und auch zum Teil China enorme Auswirkungen hat auf die Umwelt. Also da gibt es ja Flüsse, die sind enorm verseucht durch Antibiotika, die da in das System gelangen. Auch das müssen wir mal im Kopf behalten. Ich wollte noch mal einen Punkt sagen, weil hier ist ja jetzt viel von Tieren die Rede. Weil wir kriegen jetzt den Vorwurf mit Sicherheit, ja, aber in der Tierhaltung ist doch Antibiotika um 50% gesenkt worden. Das hat gerade jemand geschrieben, seit 2011 bis jetzt 50% Senkung. Ja, das ist auch ein guter Schritt, das muss man auch würdigen. Ich finde, das ist allein schon dadurch, dass man darüber redet, gelungen, viele davon zu überzeugen, dass man es vielleicht nicht einsetzt. Aber was ich auch gesagt habe, wir sind im Moment leider an einem Punkt, wo es nicht weiter zurückgeht. Und wir müssen natürlich auch über die Humanmedizin reden. Das dürfen wir nicht vergessen, weil jetzt mit Sicherheit wieder Tierärzte sagen, ja, wir sind ja nicht schuld, dass so viel Antibiotika eingesetzt, sondern es ist die Humanmedizin. Die Humanmedizin sagt, wir sind nicht schuld, es ist die Tiermedizin. Beide Bereiche können noch eine Menge tun, um Antibiotika zu reduzieren. Also nicht jeder Schnupfen muss mit Antibiotika behandelt werden. Auch da gibt es noch Möglichkeiten, das hier mal ausdrücklich zu sagen, weil ich weiß, was morgen bei mir aufschlägt im Büro, das heißt, ja, ihr redet wieder nur über die Tierärzte und redet nicht über die Humanmedizin. Wir müssen beide Bereiche im Auge behalten und wir müssen es insgesamt als Ziel setzen und nicht nur über Tiere reden. Aber da haben wir im Moment meiner Meinung nach die größeren Möglichkeiten anzusetzen. Und ich hoffe, dass wir das wieder auf die Agenda. Erinnert sich jemand an Angela Merkel, former Chancellor of Germany? Die hat das Thema bei den G7-Gipfeln ganz oben auf die Agenda gesetzt, ganz oben. Damals hat die Welt sich darauf verständigt, wir müssen was tun. Jetzt haben wir eine amerikanische Regierung, wo ein Impfgegner es bestimmt und wo das Geschehen bestimmt und wo Amerika ausgestiegen ist aus der Finanzierung vieler internationaler Organisationen, auch aus der WHO ausgestiegen ist. Ich halte das für einen ganz, ganz gefährlichen Move, den die Amerikaner da machen. Wir müssen die Amerikaner wieder an Bord holen. Vielleicht dauert es 2-3 Jahre, aber wir müssen sehen, dass wir global agieren und nicht jetzt nur sagen, die Europäische Union muss jetzt die Führung übernehmen. Ja, muss sie, aber wir müssen auch weltweit und vor allem in Amerika die Amerikaner wieder an Bord holen.
Thank you, and thanks for bringing up that we still need to talk about human antibiotics, because I was actually about to ask you, Kiko. We have also this target from 2024, I think it is, this 70% of human antibiotics should be coming from the so-called access group to avoid using too many broad range antibiotics. How can you actually, you being the, in this case, the support that and make sure that also there's equitable access to those antibiotics?
The same button.
Thank you. Will be working.
Right. Okay, so thank you very much for that. Now I can talk about my responsible role about the access to the health products. So in terms of the target for the 70%, antibiotics should be come from the access category. So WHO providing the essential medicines list, including the WHO aware antibiotic book. So this is the priority, the list for the priority antibiotics with categories of the aware, watch, reserve. So this is came from the scientific research. Then the technical advisory group convened by WHO to assess of all the scientific data, and then they make the list, and then we update it every 2-3 years. Then we launching the list for the priority antibiotics book, then they can also be providing the technical assistance to the country to implement those information into their own national list for the essential medicines. Then meantime, so some of the small country needs to negotiate with the manufacturer, particularly price. Then if the market is quite small, so price should be going expensive. So then meantime, so WHO supporting the creating the pooled procurement system in the regional level beyond the countries to make sure the certain size of the market. Then the strategy increasing the power of the negotiation with the manufacturer, then we are discuss. Then meantime, so international partners like UNICEF or the Global Fund supporting those countries to including the financial support. But we make sure all those, then we make sure for the access to that's the specific antibiotics in the countries, particularly low and middle income countries. Then meantime, so what is important is the creating the capacity for the rational proper use of those antibiotics in the health facility plus community. Then the health facility is much easier than the community. So community, once patient or the parent of the children to go to pharmacy and then they get the antibiotics over the counter. Then the pharmacist talking it's this antibiotic should take 5 days. But normally symptom will disappear 2-3 days. Then the parents wants to reserve of the rest of the antibiotics for the next time. So this is also the one of the reasons to create their resistance. So the pharmacist needs to educate the parents, but parents want to reserve their things because of the economical status or the low and middle income country. So how we can solve those? A big question. Then meantime, so there are some of the countries providing those antibiotics to buy free, only for the children less than 5 years old. This is also needs to the sustainable health financing, also the essential services. So currently, I'm the responsible for the health system division since the Monday last week. Then now I oversee not only the health products, overseeing the health finance, economy, health workforce, nursing, and also the data digital and then data analytics. So if we providing something, the prescription into the app on the phone of the each parent having, and then if we can using some new technology to monitoring the how to consume the really or the not. So it is also one of the solutions in those the low and middle income country to increasing or the promoting the proper use. So anyway, so I say again, for that, what important is those holistic approach, not only health product, health system, education of the health workforce, or the health financing. So now WHO restructured the organigram within the organization. Then I'm currently having the huge task to oversee all the health system, but this is also opportunity. I'm so exciting. So please work together with us, together with the Quadripartite organization to make things happen. Thank you.
Thank you. And there was a question over there. No, it's working.
Yeah, now it's working. Okay. Sorry, I think I will speak in German afterwards. But first of all, thank you that we're all talking about One Health policy and we highlight different perspectives on an AMR. I'm a representative of a German health insurance company, and I would highlight once again, as Mr. Häusling already mentioned before, the kind of the drug production issue and the treatment of the pollution of the wastewater. So I will continue in German. I'm sorry, but it's a bit easier for me to describe. Genau, was ich nochmal erklären möchte oder nochmal einbringen möchte, ist, also ich bin Teil der AOK Baden-Württemberg und wir repräsentieren mit der AOK-Gemeinschaft in Deutschland knapp 26 bis 30 Millionen Versicherte. Und im Rahmen der Ausschreibung für Arzneimittel haben wir uns auf den Weg gemacht, Nachhaltigkeitskriterien einzuführen. Was bedeutet, dass wir bei den Antibiotika, bei unseren Ausschreibungen einen Bonus eingeführt haben für die pharmazeutischen Hersteller, die sich verpflichten, dass wir mit einem wissenschaftlichen Institut zusammen Messungen vor Ort in Indien, aber auch in Spanien und Italien bei Antibiotika-Produktionsstätten, wo die Wirkstoffe hergestellt werden, durchgeführt haben. Und da haben wir sehr besorgniserregende Ergebnisse gefunden. Das ist auch die erste Studie dieser Art, dass eben wir als Krankenkasse im Rahmen der uns rechtlichen Möglichkeiten im deutschen und europäischen Vergaberecht eben hier vor Ort kommen konnten und die Situation nochmal aufdecken konnten. Da gab es ja auch diverse Recherchen schon zuvor über die Abwasserproblematik, vor allem in Indien. 2017 war mal so ein Report, auch der ARD, also deutsche Journalisten, die sich da dieses Thema angenommen haben. Und da sind wir eigentlich darauf aufmerksam geworden und haben uns da auf den Weg gemacht. Und ich möchte einfach nochmal in diesem Rahmen betonen, also wir haben natürlich sehr besorgniserregende Konzentrationen gefunden, aber es ist nicht nur alles negativ. Wir haben zwar nur eine Spitze des Eisbergs, weil das natürlich freiwillige Vertragsvereinbarungen sind, aber positiv kann man durchaus auch nennen, dass eben im Gespräch mit den Herstellern, die sich auf den Weg gemacht haben und die Verträge mit uns geschlossen haben, durchaus gezeigt hat, dass sie zum einen über die Situation gar nicht in der Form im Bilde waren. Also es wurden teilweise tausendfache Überschreitungen von Grenzwerten im Antibiotika sowohl im Abwasser als auch dann in der angrenzenden Umwelt gemessen, was natürlich sehr besorgniserregend ist. Gleichzeitig gab es aber auch bei Wiederholungsmessungen durchaus Verbesserungen, die festgestellt wurden, nachdem wir mit den Herstellern in Kontakt getreten waren. Einige haben die Abwasseraufbereitung geändert. Insofern möchte ich einfach dadurch nochmal darauf aufrufen, vielleicht, dass man hier als Europa auch versucht, irgendwie einen gemeinsamen Ansatz zu schaffen, weil natürlich als Krankenversicherung in Deutschland mit einem ganz begrenzten Zahl von Versicherten haben wir natürlich einen ganz anderen oder einen kleineren Hebel, als wenn man europäisch gemeinsam hier im europäischen Markt vielleicht die Produktionsbedingungen vor Ort durchaus auch mit beeinflussen kann, indem man gewisse Umweltkriterien durch Nachweiszertifikate oder Ähnlichem hier verlangen kann. Eben die Marktmacht des europäischen Marktes, dass eben beispielsweise nur Antibiotika auf den Markt kommen, die sauber in Anführungsstrichen produziert wurden. Natürlich haben wir dann wieder diese Schwierigkeit mit den Lieferketten und man möchte natürlich beliefert werden. Also man darf natürlich die Versorgungssicherheit gegen die Umwelt nicht ausspielen. Aber es wäre, glaube ich, ein sehr wichtiger Punkt und es ist uns ein sehr großes Anliegen, auch als deutsche Krankenkasse, dass man hier europäisch vielleicht einen Schritt weiterkommt und dieses drohende Gesundheitsproblem, das ja heute schon reell ist und das immer größer wird mit den Resistenzen, eben im Bereich der Produktion zumindest hier mal auch in gewisser Weise an der Wurzel zu packen.
Thanks for this intervention. I'm afraid we have to come to an end, given that we're already 1 minute past 11:30. You have the last word, Mr. Vlad.
Thank you.
Yeah.
That's the
First
short
base,
version.
that's what he said.
Yes. Thank you. So I should begin by thanking Mr. Häusling for gathering all of us, for getting the initiative. If I may add a couple of remarks. I think in the last term of the European Parliament, of the European Commission, it felt to me, I wasn't here back then, but it felt to me that we were finally starting to tackle some of humanity's big problems. So climate change with the Green Deal, and then, of course, the Beating Cancer Plan, and AMR was also a bit back when Mrs. Merkel was putting it high on the agenda. And then other global health threats. We also had the pandemic, and it seemed that we're going to learn some lessons from that. Now in this mandate, first, we have high-ranking politicians that are pretty open about not wanting to do anything about things that they can't see or see with their own eyes or touch with their own hands. And also we have lots of man-made crises like wars, trade conflicts, tariffs, and other geopolitical shocks that keep us pretty busy. There is, of course, there is still a lot of space for efficiency, and food waste was mentioned. This is still horrific, and we're not doing a great job here in Europe. There's a lot of space for improvement. Then antibiotics waste, and not only waste, but also we're not only wasting resources, but also causing harm to people and animals. And it was mentioned hospital waste or hospital overuse of antibiotics. And this is something that is primarily in the care of the of healthcare professionals, but also healthcare authorities, and also in the community, but in agriculture as well. And the costs that all of these are producing, are causing for us as societies is also immense. So in terms of efficiency, we should not only look at the inputs, but also the sort of outputs. We have obesity rates that are exploding. We have AMRs that is causing enormous costs. So AMR is not an absent threat. It's a silent pandemic causing 1.3 million lives every year, and these are people with names, families, and futures. So we definitely need to act decisive. I would like to thank again to MEP Häusling and Dr. Yukiko Nakatani. Congratulations for your new appointment and for the challenges that come with them. So good luck with that. I think with the policy brief presented by Philip Matthew was great, not only guidance, providing us not only guidance, but a very practical path forward. I must say I've been looking through the brochure here. This is the most comprehensive I've seen so far. So I think we have tools. Maybe we haven't identified all the necessary tools, and public-private partnerships have been mentioned here. There is a lot to do on that front, but the One Health approach is definitely not longer a concept for just for conferences, but it's obviously the only way forward. Human health, animal health, and then environmental health are inseparable. We have the knowledge. We have, I think, we can still speak about a global consensus if we're going beyond the rhetoric. And what we need is political will and some courage to turn recommendations into regulations, but also into funding and real-world impact. So us here as members of the European Parliament, we do carry a unique responsibility in the SANT committee, and that's good news that we do have a SANT full committee, fully fledged committee where we can discuss and decide on legislation. We're putting this topic high on the agenda, all of us, and this is not only about collecting dust, but it should become the fabric of our work here. So we need coordinated legislative action and cross-sector collaboration, and this is what we're going to push for the years to come. Thank you.
So thank you all for participating, listening, be it here in Brussels or from remote, and a very good day to all of you. Thank you. Thanks to my panelists.
Thank you to Mr. Kafsak for the moderation. Thank you to my team, Lina and Johanna, managed a lot of work here, and to all my colleagues that helped for this organization. And thank you to you. And I think it's a starting point for broader discussion, and hope we can make a new presentation maybe in the next month, and we bring it on the agenda of the Sound Committee and on ENVI Committee. So we have to move forward in slow and move, not in a slow move, in a very hurry move to bring things on a better way. Thank you very much to all, and have a good day.